Skin cancer due to sun exposure appears faster and is more severe in males than in females. The most rapid rises are seen in developing countries, where breast cancer risk has historically been low, relative to industrialized countries. Increasing trends in developing areas are often considered the result of the westernization of lifestyles, an ill-defined surrogate for changes in factors such as childbearing, dietary habits and exposure to exogenous estrogen, towards a distribution closer in profile to that of women in industrialized countries. The high rates of breast cancer in developed countries are the consequence of a higher prevalence of the known risk factors for the disease, many of which, early age at menarche, nulliparity, late age at first birth, late age at any birth, low parity, and late menopause, relate to the hormonal, largely estrogen, milieu, to which the breast is exposed from menarche to the cessation of ovulation at menopause. The higher parity and earlier age, at first pregnancy of women seen in many developing countries, might account for much of the lower incidence of breast cancer in these regions, relative to developed countries. The long-standing hypothesis, that breastfeeding of longer duration is protective, has been affirmed again recently. Exposure to exogenous hormones as oral contraceptives and hormone replacement therapy result in an increase in the risk of breast cancer. Differences in childbearing and breastfeeding habits could partly explain why rates of breast cancer are so low in the developing world. Even if women in the West were to breastfeed each of their children for an extra 6 months, this could prevent 5% of breast cancers each year. This cancer burden is also increasing, as people in the developing countries adopt Western lifestyles, such as cigarette smoking, higher consumption of saturated fat and calorie-dense foods, and reduced physical activity. Many women don't want to go for screening because they don't want to know they have it. Many issues are related to Islamic culture. I cannot expose my breasts, especially if it is a male physician. My husband doesn't give me the permission. Or, whoever has cancer, God is punishing her. They called it the evil disease, she said. One woman said she wouldn't tell anyone if she had breast cancer because it would influence her daughter's chance of a good marriage. Stop spreading your stupid ideas. Women need to get the right information and get the necessary screening to detect this terrible disease, and get a successful treatment. If people think this is a punishment from God, then women will be reluctant to get a proper treatment, and ignorant people will label them as sinners. That needs to stop. Don't be a voice for stupidity, be a voice for the change and improvement for our world. Think.